Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today we're talking about oral contraceptives. We're going to talk about the combination progestin and estrogen and the progestin only pill. We're going to talk about side effects and the teaching related to those that the nurse has to do with patients. This is very likely to be on your NCLEX. So let's go ahead and get started. Hello, Clinic Review family. Today, my dogs are keeping me company. I was away yesterday for 12 hours at the hospital, and so they are wanting to spend time with me today. So I've got two of them here. Come here, Bubby. Come here, Bubby. Yep. See, these two are brothers. They were in the same litter. Their mom and dad are also owned by us, and they are the sweetest little puppy dogs. This one is Barkley and this one is Israel. All right. So that's the fun stuff. We got that out of the way. This YouTube channel is a part of the Greater Clinic Review organization where you can take seriously the very best NCLEX review in the entire universe. There, Mark Klimek, the GOAT himself, teaches that review. It's online on demand, and you get access to it for, I don't know, I think you can pick how long you want, but it's like 3-4 months you can get it for. I also recommend it, by the way, if you're still in school. I do recommend taking it. It is extremely helpful for any of those standardized tests you have to take. If you're in an ATI school where all your tests are ATI or standardized tests, it's helpful with those. So it is something you may want to consider doing, even if you're in school. We also have packages for small group tutoring, monthly packages, and our streaming service. Today, we are going to be talking about oral contraceptives. So there's two different types of oral contraceptives we're going to talk about. There's the combination. The combination is progestin and estrogen. And I've already done a video on the menstrual cycle for women, or the ovulation cycle for women. And so you should already know that estrogen is present in the first 14 days. It helps stimulate the ovulation, and then progestin is present in the second half of the cycle, and that helps get the uterine lining ready for implantation. And so when you take a combination estrogen progesterone, you keep those levels at a normal level or at an acceptable level in the body, so the body doesn't think it has to secrete those things. So if the body doesn't think it has to secrete those things, then you're not going to ovulate. So the estrogen prevents ovulation, and then the progestin prevents getting the uterine lining ready for implantation. So it prevents implantation. So the combination drug does two things, and then you can take progestin only. Progestin only, generally speaking, is thought to have fewer side effects. It's the estrogen that often causes thrombolytic events, headaches, and so forth. And so so the estrogen pill is contraindicated with hypertension, with DVT, with migraine headaches, those kinds of things. So progestin can be used in those circumstances, but you take the progestin consistently. So the estrogen progestin pill is taken generally on a 21 7 to 7 day cycle. So 21 days on, 7 days off. So the combination estrogen progestin is 21 days on, 7 days off. So it's a 28-day pill pack. And if you've ever taken them, you know they come in these round circles, and you take it according to the day, so you can see if you missed a dose. There are other ways to take the combination pill. So you can do a 24-4 combination where you take 24 days off, 24 days on, 4 days off. It's a placebo. You can take nothing. You can take the placebo pill. That decreases, the side effects of menstruation. So you have fewer cramps, you have fewer headaches, and then they can take it where they just take it through all the way. There's no placebo pills. They're always on the hormones, and they won't ever have a period if they do that. And so there's pros and cons of both of those things, and they would look at the risk factors associated with clotting and headaches and other things to decide if they're going to put a young woman on the combination oral contraceptive. If you're asked about combination oral contraceptives on the NCLEX, you should assume it's a 21 7-day cycle, unless they tell you otherwise, because that's the most commonly prescribed method, is the 21 on, 7 days off. And then progestin is consistently on, just 28 days consistently on. It can prevent ovulation. It often prevents ovulation, but that's not its primary mechanism of action. Progestin only prevents implantation. And so they're on it 28 days or constantly. There's no off days. And progestin only also has a short half-life. And so they need to be more consistent in taking it. So we recommend they take it at the same time every day. The combination estrogen progestin should be taken at the same time every day. But if they forget, they can just take it when they remember. Whereas the progestin, we recommend taking it at the same time within a 3-hour window, the same time every day. And if they miss a dose, they actually have to use backup contraception for 7 days. All right, let's go ahead and do some questions. All right, a 37-year-old woman with a history of hypertension is considering starting combination oral contraceptives. What is the nurse's priority action? Suggest switching to a progestin-only pill. Advise her to use barrier methods for birth control. Recommend a lower dose estrogen contraceptive or proceed with prescription as planned. So she's older, which is over the age of 35. We usually don't recommend the combination oral contraceptive because the older they get, the increased risk for thrombotic events. So we don't generally recommend it for people over the age of 35. She also has a history of hypertension, which increases her risk for thrombotic events. If she was a smoker, it would be contraindicated. If she had a history of DVT, it would be contraindicated. So she has 2 risk factors. So we would suggest that she switch to the progestin-only pill. That would be a better thing for her. A breastfeeding mother asks about contraceptive options. Which oral contraceptive is most appropriate for her? Combination estrogen progestin pill, progestin only, extended cycle contraceptive, or high dose estrogen pill. So as long as they're breastfeeding, we don't recommend estrogen because it reduces the milk production. So they can take birth control while they're breastfeeding, but it's progestin only pill. And the other thing to remember is that they shouldn't be on the combination oral contraceptive in the first 4 to 6 weeks after delivery. And that's because during the first 4 to 6 weeks after delivery, they have a higher risk for thrombotic events. And so they shouldn't be on that estrogen. So they can start progestin pretty much as soon as they want to, progestin only, but they recommend not doing the combination pill while you're breastfeeding and not doing the combination pill for the first 4 to 6 weeks after delivery. A patient misses one active combination birth control pill. What instructions should the nurse provide? Take the missed pill as soon as remembered and continue the rest as scheduled. Discard the missed pill and double the dose the next day. Stop the pack and start a new one immediately. Use backup contraception for 7 days. So with one missed pill, they don't have to use backup contraceptives. They should take the pill as soon as they remember. That's the recommendation. If you miss a dose, take it as soon as you remember. If they normally take it at night and they remember in the morning, then take it in the morning and then take their pill as scheduled again that night. If they normally take their pill in the morning and they remember that evening that they forgot a pill, take it that evening and then the next morning take the morning pill as scheduled. When discussing side effects of birth control pills, which statement by the nurse is accurate regarding breast tenderness? Breast tenderness is rare and should be reported immediately. This side effect often decreases after a few months of use. It means the pills are not suitable and you should stop them. Only high-dose pills cause breast tenderness. Well, if you're a woman, then you know that the hormone fluctuations are normal and breast tenderness is normal during your hormonal cycle. And by keeping a consistent amount of estrogen in your body across a 21, 28-day cycle, you're going to have breast tenderness kind of throughout that cycle. But the thought is that it's a side effect and that it decreases after a few months of use. So that's what we teach people. During a follow-up visit, a patient reports nausea since starting combination oral contraceptives. What is the nurse's best response? Stop taking the pills immediately. This indicates the pills are not suitable for you. Double the dose every other day. Take the pill at bedtime or with food. So we recommend when pills cause nausea, because nausea is probably the most common side effect of any oral medication, we recommend taking it with food. And the reason we recommend it at bedtime is so that if there's any nausea, you sleep through it. I don't know how well that works. I've given that recommendation before. I've been given that when I was younger. I don't have to worry about this anymore. But when I was a lot younger, I was given that recommendation, and it was not, I just got sick in the middle of the night. So I don't know how well it works, but on the NCLEX, y'all, it works. Okay. This works on the NCLEX. So pick it. A patient missed 3 active combination pills in the first week. What is the nurse's best advice? Take 1 pill now and continue with the rest using backup contraception for 7 days. Discard the current pack and start a new pack immediately using backup contraception. Take all 3 missed pills at once or wait for the next menstrual cycle to resume pills. So the recommendation is that when you miss 3 in a row of the combination contraception, the oral combination contraception, if you miss 3 in a row, this is the rule for 3 in a row, you discard your pack and you start over with a new pack. It doesn't just have to be in the first week. It's recommended that you throw it out and start a new pack, and you do have to use backup contraception until you get back into the normal cycle. A patient is prescribed antibiotics while on oral contraceptives. What should the nurse include in the patient teaching? No additional precautions are necessary. Use a backup contraceptive method used during antibiotic therapy. Stop taking oral contraceptives while on antibiotics, or increase the dose of oral contraceptives. So the rule is that oral or any kind of antibiotics reduces the effectiveness of oral contraceptives, and you have to use backup contraception during that period of time. If you're wondering what backup methods means, it could mean a diaphragm, it could mean a condom, it could mean abstinence, but something else. So if you don't want to get pregnant, you don't get pregnant. If a woman misses 2 consecutive active combination pills in week 2 of her pack, what should the nurse advise? So this doesn't matter that it's week 2. But I put that in there so that you could understand that it doesn't matter, so you don't get confused by that. So if a woman misses 2 consecutive active combination pills, what should she do? Take 2 pills daily for 2 days and use backup contraception. Discard the pack and start a new one. Continue taking 1 pill daily without taking the missed pills, or no additional action is required. So what that you recommend is that they take it the next day. So if you've missed 2, then on day 3, you take 1 of your missed pills. And on day 4, you take your other missed pill. And you should use backup contraception for 7 days. And it doesn't matter that it's week 2. So if you're asked the question, what if they miss a dose? The answer is take it as soon as they remember. If you're asked the question, what if they miss 2 doses? The answer is you take it with the next 2 doses. A patient asks why she needs to use backup contraception after missing 2 consecutive combination pills. The nurse explains that the hormone levels may not be sufficient to prevent ovulation. Missing pills increases the risk of side effects. It prevents the pills from causing nausea. Backup methods are only a precaution, not a necessity. So it's because the hormone levels may not be sufficient to prevent ovulation. So remember, we're keeping a steady state of estrogen in the woman's body so that the brain doesn't sense this low level of estrogen. Because if the brain senses a low level of estrogen, it's going to increase the level of estrogen, which could cause ovulation. Remember, estrogen is what precedes ovulation. So that is important, that for the next 7 days, because what if they ovulate? What if they miss 2 doses and they ovulate? When are they likely to have that egg be fertilized? Well, the egg's only good for 72 hours. So for the next, I guess you could say 3 days, but let's be safe and say 7. A patient on combination oral contraceptives reports missing her period this month. What should the nurse advise? Stop taking the pills immediately. Double the dose of pills for 1 week. Continue taking the pills and consider a pregnancy test if she misses 2 periods. Schedule an urgent appointment with the healthcare provider. So it's not that unusual to miss periods when someone's taking oral contraceptives. So look, they're welcome to go out and get a pregnancy test if they want to, but we don't recommend it because we say it's not that unusual to miss a period when you're on oral contraceptives. So continue taking the pills as ordered. And if you miss 2 periods, go ahead and take a pregnancy test. But after 1 missed period, it's not recommended. I mean, someone wants to spend the money. Pregnancy tests are expensive, y'all. So if you want to spend the money, go out and spend the money. You're going to spend like $30 on one though, to get one from the drugstore. A patient is concerned about breakthrough bleeding after starting a new pack of pills. How should the nurse respond? You should stop taking the pills immediately. This indicates the pills are not effective for you. Double your dose until the bleeding stops. Breakthrough bleeding usually resolves after a few cycles. So this is just like nausea and breast tenderness. Nausea, breast tenderness, and breakthrough bleeding are expected side effects, and they usually resolve after several cycles. That's usually what we teach. Now, if they say, I can't handle this, I don't want to take these, fine. They can use a different method, but they are considered side effects, which means nurses teach about side effects and teach patients how to manage them. We don't call the doctor about side effects. It's our responsibility to teach patients how to manage those. Adverse effects, on the other hand, is something we do stop the medication for, and we do contact the doctor. So if they call in and they say, my right leg calf is swollen, I'm going to go, stop the med. Let's call the doctor, because that could be a DVT, which is an adverse effect of oral contraceptive use. A woman is switching from combination pills to progestin only. What important teaching should the nurse provide? You can start the progestin only pills at any time without backup. Ensure you take the progestin only pill at the exact same time every day. Progestin only pills have a wider window for missed doses. Expect fewer side effects with progestin only pills. So the question is what important teaching? So in other words, it's a most important or best or highest priority. So when you look at those, you have to say, look, there may be more than one true statement here, but which is the highest priority? What's the goal of the pill? The goal of the pill is to prevent pregnancy, right? So we want to make sure she knows how to prevent pregnancy. You can start the progestin only pills at any time without backup. That's actually not true. Ensure you take the progestin only pill at the exact same time every day. That's true. Now, they have a 3-hour window, but we usually say, look, just take it at the same time every day so you don't forget, right? Because it has a shorter half-life. And so you can't, for the progestin only, you don't say, as soon as you take it as soon as you remember. If they miss a progestin only, they can take it as soon as they remember, but we recommend that they use backup contraception for several days. Progestin only pills have a wider window for missed doses. That's false. So A and C are false. Expect fewer side effects with progestin only. That's actually true. That's one of the reasons we put women switch to progestin only, is they don't cause headaches. They don't have the contraindications with hypertension and so forth. But which is more important? So which is a higher priority? That we tell them they take it at the same time every day because that helps prevent pregnancy, or, hey, it's nice that there's fewer side effects. Actually, it's more important that we tell them B, because that's the whole point of giving the medication. And so we have to do B. Okay, so I hope that was helpful to you. I hope you have a great rest of your day, and I'll see you later.